Hello, I'm Dr. Naveed and I want to talk to you about prostate cancer. Now, this is quite a sensitive subject and I can understand why sometimes men delay their presentation to their doctor because of the fact that it's quite embarrassing talking about this. I want to use this video, this opportunity to remove some of those anxieties that you might have because there is quite a lot of misunderstandings. I just want to give you 3 symptoms to remember by the end of this video, and if you have any of these symptoms, if you've got any concerns, you can talk to your doctor about that. Now, what is prostate? The prostate is a gland that sits very close to the bladder. It's a gland that helps you with sexual activity and sexual function. However, it sits quite close to the bladder, which means that when the bladder is being emptied of urine, you will have symptoms when this gland is enlarged. When it's bigger than usual, you will have urine problems. And that's a way that we can find out if you're having prostate problems, because it can be related to your urine. Now, prostate cancer affects men over the age of 50. Usually there's a family history as well, and so if you have that, it's always good for us to know that. The 3 symptoms I want you to remember is, one of them is increased frequency. So if you're having to pass urine, if you're having to pee more than usual, and that's not your usual self, and even with the fact that you're not feeling thirsty, you're still having to pass urine mostly at night time as well as during daytime, get in touch with us, because that's something that's quite unusual. Now, there's lots of other reasons that could be causing this, but we can find out why. Now, the second symptom is that you're having to push the urine out when you go to the toilet. You're having to force it out. Now, normally that should not be happening. However, when the gland is enlarged, it's actually blocking the bladder, and therefore you're having to squeeze out more. The last symptom is that when you are passing urine, you'll notice that you'll feel that your bladder is not emptied properly. So you might think you've finished, you've left the toilet, you've walked away from it, but then you've noticed that you need to pass urine again and you're going straight back. That means your bladder's not fully emptied, and when you're having to go back, you have noticed that you're passing more urine. Again, that is a sign of bladder obstruction caused by the enlarged prostate. These are the 3 symptoms I want you to remember. Now, to reassure you, the majority of cases, it's not prostate cancer, it's prostate enlargement. However, we can help distinguish between the 2. Now, many men are often aware of the PSA, which is good because of the campaigns that have been raised through celebrities like Ben Stiller or Robert De Niro or Michael Parkinson. These people had prostate cancer and they helped raise awareness, which was very good. If you know about the PSA, you can read about it, but we can tell you what the PSA is. This is basically a blood test. Now, it's not 100% accurate, this blood test, because other factors can cause the PSA to rise. However, it is a good first test. So we do examine the gland as well, and we can talk to you in more detail. However, don't worry, it doesn't always have to be on your first consultation, because I can see many men are hesitant when they first arrive and they're nervous because that's on their mind. But we can talk about that, we can plan it together. The third most important part is the history. So if you can remember these symptoms, you will be asked about them. So even if you have a raised PSA, or even if you have a normal PSA and your history is suggesting that there is a prostate problem, we could refer you. If we examine you and if we notice there's a prostate problem and you might have a normal blood test, we still refer, or we talk about your options. So as you can see, we need all 3. Now, when you are referred to the hospital, if for example your PSA is raised, you might have an MRI scan or a biopsy. But this video is more about you recognizing your symptoms and not to be hesitant and not to delay your presentation. Now, this particular message is for the younger generation now. If you notice that your father, if you're living in the same house, or your father tells you he's having to pass urine more than usual, have a chat with him. Now, I can understand this can be a difficult subject to talk about due to cultural differences, the age gap. Mothers are very good at this because they can spot changes in behavior in their husbands. There are ways to find out, or your father might just be quite explicit and explain to you that, look, I'm having urine problems. But either way, it's very important to be sensitive. And this is, like I said, this is a message for the younger generation, to be sensitive and listen to these telltale signs. Thank you for watching. I will see you next time.